Hey, welcome back to New Day Cleveland. Don't settle for living in pain. Here with advancements in joint replacement surgery is Dr. William Scully from Crystal Clinic. How are you, doctor?
I'm doing well. Thanks for having me.
All right, you look really happy, so I'm going to assume you're pain-free right now.
Feeling pretty good. Thank you.
All right, good. Well, we were talking, I got some knees here that they're feeling okay right now, but I play tennis a lot. I'm like, man, is there anything preventative we should be doing?
Absolutely. Anytime somebody presents to our clinic with new onset or early signs of arthritis, we'll start with some conservative treatment measures, and that can range from over-the-counter medications to injections, physical therapy, bracing. So there's a lot we can offer short of surgery for you.
So when you're talking about arthritis, is that something that's just going to occur, or is it something that people can do to make it bring it on?
I could go all day with that one.
Okay.
Arthritis often is just something that builds up over time, kind of like car tires wearing down, but there obviously are conditions that can predispose you to arthritis. And then after injuries, you can sometimes develop what we call post-traumatic arthritis as well. So there's a lot of different variations of arthritis.
So what would happen if I woke up one day, what would happen and make me say, I need to head over to Crystal Clinic today?
Give us a call and we'll get you an appointment.
But I mean, what would the reason be? Do I need to do that for hip replacement, knee? What do you specialize in there?
So I'm a hip and knee replacement specialist.
Okay.
I also do a lot of sports medicine. I was in the military prior to joining Crystal Clinic and was taking care of soldiers, and so obviously doing a lot of sports medicine type work. So I do a little bit of both joint replacement and sports medicine.
All right. Now, one of the things we were talking about is the Mako system, which I'm not familiar with at all, so educate us.
So the Mako system is something that originally came out for partial knee replacement several years ago, and now has progressed to utilizing it in full knee replacements as well as hip replacement surgery. And basically what it is a robot that we utilize during surgery, basing our plans off of a CT scan we get of your knee or your hip before surgery. And it just adds an extra level of precision to the procedure we're doing. So we can plan how we're going to put those implants into your body, and then during the surgery fine-tune that plan, and then the robot assists us in putting those implants exactly how we've set it up to do.
Okay, now a lot of people, I think the two main concerns people have are when they get something like this, pain and taking forever to recover. So address that.
So I think we've made a lot of progress over the years in terms of the recovery as well as our pain management strategies. We approach it with a number of different ways of controlling the pain, different types of medication that address the nerve aspect of pain as well as the soft tissue aspect and the swelling. And so I think we see patients that had surgery 30, 40 years ago and tell us these stories of being in the hospital for months. That has certainly changed, and I think with the multimodal approach we've taken, that's gotten a lot better.
Okay, so people should call you as soon as the sooner the better, I would think, instead of letting something build up and get worse.
Absolutely. I mean, no one wants to live in pain, and as we talked about at the beginning, we have different ways of making people feel better. It doesn't necessarily mean surgery, but we can start the process of working on it.
All right, so we're going to check out Dr. Scully at the Crystal Clinic. Thank you so much.
Thanks for having me.
All right,
Happy
David,
holidays.
what do you have?